COVID-19 changed our world. From lockdowns to vaccines, we have seen the best and the worst in how we respond to crisis. But did we really learn the right lessons, or are we yet to repeat the same mistakes? My name is Harmilan, and today I will be discussing the lessons learned, observed, and lost during COVID-19. Let's see COVID-19 from the start. First wave was during 2019 when the first case of COVID was found in Wuhan, China. The second wave was in 2020 when WHO declared COVID-19 as a global pandemic. Then, third wave was in 2021 when mass vaccination campaigns began. In 2022 was the fourth wave when Omicron variant led to high case numbers but fewer hospitalizations. Lastly, 2023 and onwards, COVID-19 still exists, but vaccines, treatments, and awareness help control it. Some of the lessons learned from COVID-19 include proper vaccine and how quickly science can move when the world works together. The rollout of vaccines was done fairly quicker than the usual time it takes for the production of a vaccine. Secondly, virtual care to telehealth helped people get care from home and receive medical advice efficiently. Thirdly, mental health also became a global conversation and increased awareness about emotional well-being. Lastly, throughout the countries, communities came together to support marginalized population through food aids, becoming a support system, and conducting regular check-ins. Lessons observed from past pandemics comparing 2009 H1N1 influenza versus COVID-19. To begin with, misinformation regarding vaccine safety emerged during H1N1. Similarly, debate against masks and vaccine hesitancy was observed during COVID. Next, there was shortages of ICU beds and ventilators. And similar to that, overcrowdedness in hospitals with each wave persisted during COVID-19. Thirdly, marginalized population was at high risk during H1N1 influenza, and same groups experienced higher hospitalization during COVID. Lastly, frontline workers were at high risk without adequate protection during H1N1 influenza. And similarly, frontline workers went through both emotional and physical strain during COVID-19. Now looking through a critical lens, some of the lessons lost during COVID-19 were, even though pandemic preparedness existed, however, shortages of PPE and overwhelmed health system was observed. Secondly, social media's role in spreading misinformation was already evident, but significant data was misunderstood. Misinformation is as old as information, therefore, big data were misunderstood in many big ways. Thirdly, public health and social health insurance funds were not prepared for emergency shock like COVID-19 in many countries. Failure in one country is failure for the whole planet. Therefore, pandemics require more solidarity and coordination so that poor countries could find the needed resources to treat, isolate, and combat serious epidemics. Lastly, marginalized communities always suffer more in crises. Therefore, COVID-19 amplified existing inequalities